Thank you very much. So, trauma-informed care is a topic that we're increasingly hearing about. It seems to be something that we're talking about in all sorts of workplaces, and quite rightly so, because the focus for a long time has been on the treatment of people with post-traumatic stress disorder through, evidence-based treatment approaches. But we know that people who have been impacted by trauma, particularly more complex trauma where we're more likely to get a more complicated clinical picture, don't necessarily turn up for trauma-focused treatment. They don't necessarily have the skill set, the emotional regulation to turn up once a week for 8 or 10 or 12 weeks to do trauma-focused treatment. And the sorts of people who are doing a lot of work with this client group aren't clinical practitioners, but are actually people who work in community, welfare, homelessness, drug and alcohol, other sorts of agencies where these people are more likely to present. So when I'm talking about trauma-informed care here, I'm really talking about the full spectrum, from the person at Centrelink who's taking phone calls from someone who's got a background in trauma, through to specialist trauma treatment programs, which also need to be trauma-informed in the way they provide services. So just sort of to bear that in mind, we're talking here about the full spectrum. So what is trauma-informed care? It really is about understanding the impacts that trauma have and how people present, and being able to design the service system and the policies of a service and the way you interact with someone that takes into account those sorts of impacts. So we'll talk about what we can do, what all of us can do to support recovery at both an agency level and also at an individual practitioner level. Again, as I say, no matter whereabouts in that spectrum of services that you work. The other thing that I wanted to touch on was self-care. The importance of looking after ourselves when we're working with people who've been impacted by trauma can't be underestimated. So, trauma-informed care, as I say, it's a term that's being used a lot, but this is a definition by Hoppers et al. It's fairly well accepted across a broad spectrum. And that is that trauma-informed care is a strengths-based approach. It's a framework that's grounded in an understanding of and responsiveness to the impact of trauma. It emphasises physical, psychological and emotional safety for both providers and survivors, and that creates opportunities for survivors to rebuild a sense of control and empowerment. There's a lot packed into that definition, and I will sort of progressively unpack it as we go on. We've heard this morning from a couple of people with lived experience, and of course nothing is as compelling as hearing from people directly about the impacts of trauma, but when we sort of take it up a level and look at across a range of people who've been affected by trauma, these are the sorts of general comments that I think we can make. Many people who have been impacted by traumatic events actually don't develop post-traumatic stress, and I think that is important to acknowledge, that when we've got a day focused on PTSD, you can get into the illusion that this means that if you're exposed to these sorts of events, you're inevitably going to develop post-traumatic stress. And that's not the case. It's important to say that many people do recover. But for others, the effects can be long-lasting. And generally, the impact of single events is less severe and less prolonged than the impact of prolonged or repeated trauma. I think that probably goes without saying. It's fairly self-evident, but remembering that a lot of the work that's done traditionally, less so now, but a lot of the work that's done traditionally in terms of treatment guidelines, for instance, is based on more of a single incident sort of trauma. So we need to get better at doing research that specifically focuses on people with prolonged and repeated trauma. What we do find, though, is that those people, which what we call the distinctions often made between type 1 and type 2 trauma, so type 2 is the prolonged repeated. Those people who've had type 2 trauma are more likely to have more complex presentations, more complex needs, and are often the ones who experience the greatest barriers in accessing services. Because of their level of stability, it might be difficult for them to engage, but also because what we sometimes refer to as sort of treatment interfering behaviours, that they might behave in ways that makes it difficult for service providers to be able to cope with their behaviour and therefore to be able to provide the service that they're there. So people will get turned away from services if they're behaving in an aggressive way, for instance, or if they're presenting substance affected and you have to be clean in order to access services, those sorts of things. So they're the most difficult group, they're the most undertreated group, but they're the ones with the most problems generally. And of that sort of type 2 trauma, really early childhood abuse is the one that can be particularly damaging. When we think about the impacts of trauma, we can focus a lot on the mental health impacts. So PTSD, depression, anxiety, substance abuse. But as we've heard today, and I just reinforce here, that trauma can result in a whole range of impacts. Not all of them are about mental health, but some are more broad than diagnosis, so feelings of guilt, grief, loss, anger, shame, problems managing difficult emotions, problems in relationships, employment difficulties, risk-taking behaviour that can bring further exposures, leading to social disadvantage. And people can also have fundamental changes in the way they think about and understand the world. And all of these sorts of impacts can interact with each other and also potentially set people up to have an increased risk of further exposure to trauma because of the social disadvantage and disconnection. So what does this look like for the client? If we think about the memories, emotions, avoidance and beliefs as being sort of key elements, and within that, within the memories, we've got the person being constantly triggered by reminders, having intrusive images, nightmares. With regards to emotions, feeling tense all the time, feeling as though feelings just come out of nowhere. So, people often describe being completely numb and then being on a scale of 10, rage, anger, sadness, despair, whatever it may be, but not the gradations along that way. And the sense of I just can't stop it, I have to get rid of this emotion. The avoidance we often see, whether that's sort of taking drugs, alcohol, binging, gambling we see, alcohol, sometimes work addiction, a number of ways that people try to numb out their feelings. And then on the level of beliefs, the sorts of beliefs we often see are things like I'm worthless, I can't cope, people will betray me, I'm not safe. So if you think about the client coming into any agency, whether it's a welfare agency, whether it's a treatment service, this is what's already going on, or some combination of this is what's already going on for them. And it's not surprising then that this is what they're carrying with them, that they will often present in ways that can be quite difficult for services. So if someone is in pain, is suffering with side effects of medication, depression, troubling memories and so on, that when they present, likely to have memory and concentration problems. So not turning up when they're meant to turn up, or turning up a day early or a day late and getting upset with themselves but also with the service when you can't necessarily accommodate that. The avoidance and distrust that people... Avoidance is part of the syndrome of post-traumatic stress anyway, but people will often not want to seek help because they don't want to deal with things that are troubling them. but on the other hand know that they need help. When someone has been traumatised, particularly when it has been trauma at the hands of someone else, when it's been intentional interpersonal trauma, distrust is almost always present. So we're asking people to turn up to a treatment service and start talking to someone implies that they've got that capacity to trust. It's something we can't assume. And, we really do need to spend time developing that therapeutic relationship, no matter what the context, not just if you're doing therapy with someone, but if they're walking in to get a food parcel, if they're walking in to get a service of some sort, recognising that trust is likely to be an issue. And of course, irritability and anger. And they're the sorts of behaviours that are most treatment limiting, in a sense, that when someone is constantly irritable, anger, and acting out on that anger, it's very difficult to engage them in a therapeutic way. And they're more likely to be turned away from services. So when we're talking about supportive recovery, we are talking about it at both what can an agency level do and what can an individual practitioner do as well. So starting at the level of the agency, we've talked a little bit today already about trauma awareness, but it really is critical that agencies that are working with clients who have got a trauma background do provide the training and supervision to their staff to ensure that they understand the impacts of trauma and recognise the sorts of problems and issues that people present with, recognising those for what they are. So avoiding the jump to judgment about someone, well, this person's got a personality disorder or something that, we're quick to judge with language that can be quite pejorative, and trying to understand instead what might be going on inside the mind of that person that's leading them. What need have they got that they're trying to get met here? They might not be doing it very effectively, but we've got to understand where they're coming from. And in asking staff to do that, it's also important that agencies actively support staff self-care and resilience. Also, the emphasis on safety. So we know that when people have a trauma background, they generally don't feel safe. So what can you do at an agency level to foster a sense of safety? And that can include things, including the physical setup of a building, of the entrance, of where it's co-located, of whether there are quiet places that people can go if they need to be by themselves outside of the hustle and bustle of the agency's business. But also emotional safety, that needing to create an environment in which people feel respected and heard, and that people aren't quick to judge them or quick to try to give them what they want and get them out. Part of this is really in terms of the role clarity, making clear, or having the people who are working in an agency being really clear about what their roles are and what the boundaries of their roles are. One of the things that people who've been through trauma are very sensitive to is when a promise is made that's then not kept. So it's really important for staff not to try to keep someone happy in the moment, but actually set them up for a further disappointment or a further letdown, to be really clear about what you can't do and to communicate that with compassion. And respecting privacy, confidentiality, but also cultural differences and all sorts of diversity, so that no matter what the person comes to the agency with, they feel as though that this is somewhere that they belong and can feel comfortable. So we're really talking about policies at an agency level to try and address that. Also looking at opportunities, providing opportunities for people to actually rebuild control. Another component of trauma is that control has often been lost, or a sense of control has been lost. So we're really wanting, in pursuit of recovery, we're really wanting to rebuild that control. So giving people as much choice as possible, getting information from them, but then letting them know what the options are and giving them as much as possible. Ensuring that environments are not unpredictable. This can be really difficult because if you're working in an agency, we've done some work in Melbourne with agencies who work with people experiencing homelessness, and they're very aware of being trauma informed in the way they deliver practices, but they also know that they have other clients who'll come in and may be drug affected or may be behaving in erratic ways. So trying to create a safe place for everyone else while also responding to that person in a trauma-informed way that's not going to escalate the situation. And then the fourth point there is around a strengths-based approach, going back to the definition that I gave you at the outset about trauma-informed care. So we're really working on people's skills and strengths rather than what they can't do or what resources they haven't got. We're really trying to foster and build their skills. And then there's a parallel, I guess, to what we think about in terms of the individual service provider as well. That what we're trying to do here is promote safety and trust. So again, the clarity of the role. When you're providing information, thinking back to what we were saying before about if someone is troubled by memories, they're having problems with concentration and attention, you're really wanting to tailor the information that you're giving to someone, and you're wanting to give it in chunk-sized pieces. So not overwhelming people with information that they don't need, but really tailoring that information. And doing what you said you'll do. If you can't deliver what the person's wanting, letting them know that you can't do that and why you can't do that. But nothing worse than promising and then not delivering. At an individual worker level, providing choice and control. So making sure that you're establishing. Sometimes we find that people make assumptions about what someone's going to need. So before they even stop and listen and hear what the person wants, they're jumping in with the solutions. That can be fairly invalidating for people. So just making sure that the offer is in response to the expressed needs. Building connections. We know, and we've heard earlier this morning, about that process of withdrawal, avoidance and withdrawal that can happen post-trauma. So building up social connections, and yet on the other hand, social support being a key predictor of recovery. So really trying to make sure that the person's social connections, or if they don't have those, building those. And the fourth point there is really around a belief in recovery. So important that the individual themselves, but also the people working with someone who's affected by trauma, has a belief and hope in recovery, so that we're conveying that. Things may not get back to the way they were before, but that doesn't mean that the person is stuck where they are at the moment. So focusing on recovery is a critical component. And for those agencies and those individual workers who do have more of a, not just a one-off interaction with someone, but do have the opportunity to spend a little bit of time helping someone towards recovery, they may not be doing trauma-focused work, but there are still some basic sort of psychological skills and strategies that you can use that will help to support that recovery. So, and none of these will be new to you, but I'm just going to run through them quickly. So the first one is around problem solving. A systematic approach to problem solving. So people will often have a myriad of issues that they're presenting with and a whole lot of problems, and that's overwhelming. So helping them just to isolate those issues into discrete problems and going through the process that you would go through with other people around problem solving. What is it that you want? What's the desired outcome? Brainstorming possible ways of getting there, and then choosing a solution and developing a detailed plan around that. managing strong emotions can be a really critical element and really important for recovery. So some basic psychological strategies, again, just helping people to develop those skills to manage their emotions. So things like teaching controlled breathing. If people don't know any of these interventions, they're widely available, various sources, but one resource that might be useful if you haven't got it before is an app called PTSD Coach, which is actually built for military personnel, but it has all of these skills that you can use with clients, so it's suitable for anyone. Teaching controlled breathing, grounding, so when people get highly aroused, it's when they're more likely to either numb, dissociate, become so aroused that they can't think straight. So teaching them grounding, really helping them to get back in the here and now. And a simple exercise such as isometrics, which is a muscle tension intervention that people can do in a fairly unobtrusive way. So I could be standing up here pushing my heels together, for instance. No one can see that I'm doing that, but I can tense and relax my muscles by doing something like that. Those sorts of exercises that just help people to reduce their emotions. And helpful thinking. You know, a lot of the cognitive behaviour therapy is all based on helpful thinking, but at a very fundamental and sort of simple level, what we're trying to help people to understand that just telling yourself to feel better isn't going to work. It's not going to cut it. It's much easier to change what you're feeling by changing what you do or what you're thinking. So helping people to understand that and help them to understand when they're feeling really distressed, what is it that you're thinking or what is it that you're doing that's contributing to that, and helping them to shift. You don't have to have a postgraduate qualification in psychology to do that. You know, it really is at its most simple, it's a very basic intervention. Oh, we've gone too far now. Did you learn the reverse button as well, Kim? It's a little bit. Got it, thank you. So these, again, those of you who work with people affected by trauma will be familiar with this, but these are the sorts of thinking patterns that we often see, and it's good to be aware of them so that you can look out for them. But the idea that things will never get better. This is just my life. This is the way it's always been. This is the way it's always going to be. I can never feel safe again. So it's different to say there are some situations when I don't feel safe. That's reasonable, that's rational. But to say I can never feel safe again is overwhelming. And it's not actually true. If you can change the way people think, you can change the way they feel. And then there may be things that are associated with a particular event. So, you know, it's their fault that this happened, or in some cases it's my fault that this happened. And when people have a stuck thought like that, that can get in the way of their recovery. And building connections is really critically important. So building a safe working relationship with you and the person affected by trauma, but also helping them to build social support networks outside of your service. We see some people who really do struggle with forming relationships outside of their professional relationships and come to depend on those professional relationships to satisfy all of their social support needs. So people who want to come and see the counsellor or the person who's working in the homelessness agency because that's the only person that they've connected with or that's the only person that they've got to talk to. So rather than, you know, obviously that's an important person and you don't want to take that away, but rather than just say, well, you can only see me, you know, for 5 minutes once a week and the rest of the time you're on your own, actively helping them to find other people that they can connect with so that you're not abandoning them, because again, abandonment can be an issue for many people. This is just a sort of graphic map just to help people, and we use this with people to help them to think about the different sorts of social support and who might you be able to go to who can help you with practical things. Who might you be able to talk to who you can actually share an experience with? It's going to be a different person, but think about who you could go to for that. Who you can spend social time with. So not necessarily someone who you're going to talk to about what's happened to you or how you're feeling, but that you can just socialise with. That might be a different person again. It might be through a formal organisation rather than a friend if you don't have anyone who you feel that you can just socialise with on a friend basis. What are the important relationships that you might have had in the past that you might be able to rebuild? You might not go back to the way the relationship was in the past, but there may be people in someone's lives who they've drawn away from who you can encourage them to reconnect with. There may also be people who that individual can support and help. And that's a great thing. If someone feels as though there's someone who they can actually help, that's great for self-esteem and efficacy. And people who can help with advice and problem solving. So again, it's breaking it down rather than just saying what social supports have you got in your life, and people saying, well, I haven't got any social supports, or I've got a partner but I don't feel I can burden them with my problems. You're really teasing it apart a lot more. One of the issues that often comes up is around how do we manage when people want to disclose trauma? When is it the right time to do that? When is it appropriate to do that? But before talking about that, so one of the myths that we often hear and that has been quite prevalent for a long time is that it's best not to talk about the trauma because that's going to be damaging. If someone talks about their trauma, that's going to re-traumatise them. I'm going to do more harm than good. And when trauma disclosure is managed well at the level that is appropriate for the situation, that is simply not the case. The second sort of myth is that it snowballs, that I can't control what happens when someone starts to disclose trauma events. Again, when we're working with people who are in these sorts of organisations, we're helping them to set the parameters, set the boundaries, make it clear where those limits are, when it's a good time to talk and when it's not. So it's not an all or nothing thing. It's not like opening Pandora's box and everything coming out and not being able to contain it. And the third myth is that it will impact me, that there's something about hearing traumatic events that means that I'm going to be traumatised myself. And we do want to pay attention to self-care, because if people do this sort of work without the appropriate boundaries, then you can get some secondary trauma. But it's by no means an inevitable outcome, and it is very avoidable. So when's the place and time to talk about it? So what we will often do is sort of think about the context. Am I in the sort of work environment where this is my job to hear about someone's trauma? Or am I in a work environment where I need to know enough to know what services they need, but I don't need to know the details? If I am in an environment where I need to know some details, have I got enough time? Is now the right time? If it's at the end of a session and someone says, I need to tell you about the sexual abuse that I experienced when I was, between 4 and 10, and you've got 5 minutes left, we're not going to be opening it up at that point, but we will be coming back to that. Let's start off the next session and we can talk about that. So you're really balancing up, is it the right setting, is it the right time? Have I got the appropriate skills to be dealing with this? If all I need to know is that you have had a traumatic experience and you looking for a referral to someone to help deal with that, that's all I need to know. I don't need to delve any further. So it really is just balancing up those sorts of considerations. Thank you. I found that graphic, I thought it was quite cute. So obviously talking here about the potential for burnout and strategies to help yourself and also others, because I think often when we're in workplaces where we're working with these sorts of clients with these trauma backgrounds, looking out for each other is just as much a priority as looking out for ourselves. So when you've had a difficult interaction with someone at that moment in time, it's good to deal with it rather than just say, oh, look, I have to expect this is the sort of thing that's going to happen in this workplace. Don't think about it, just move on. Actually, it is good to reflect on it and think about the effect that that interaction has had on you, allowing yourself some time to recover if you need to. Being aware of what actually helps you recover. So knowing yourself, are you the sort of person who wants to talk to someone else about something difficult that has just happened? Or are you the sort of person who wants to just take yourself for a 10-minute walk? Just knowing how you cope best. Talk to someone you trust. In an agency level, making sure that if there are difficult incidents, that there's already a policy in place that you know how to deal with that, so you're not trying to deal with that on top of the emotional impact of what you've just experienced. Thinking about your own self-care and accessing other supports as necessary. So as I say, it's really about saying don't just assume that you should be able to cope because you're working in this sort of area. We're all human beings. We can all have experiences that impact on us, and it's really important to recognise that and to address it. And this will be different from one day to the next. Recognise what your emotional buttons or hotspots are. So it may be that you or someone close to you has had their own experience of trauma, and something that you're hearing is similar to that, or is making you think about that. That's more likely to impact on you than something someone's telling you about that has no personal relevance or connection at all. If you're in a really stressful period in your work anyway, it's likely that you're going to be less resilient to these additional stresses. Or if things are really difficult at home, if you're going through a difficult time with a child or a marriage or whatever the case may be, recognising that that's going to make it more difficult at work. And sometimes it's just having a bad day. Sometimes you just feel as though you're bulletproof and you can deal with anything, and other days you just feel like this is just too much. I feel like I could burst into tears at any moment without necessarily anything happening. But we've all just got fluctuations in mood from one day to the next. So moving on to self-care, again, planning in advance. What do you need to do more of to recharge your batteries? What's important for you in maintaining a good work-life balance, particularly when work is more difficult? And what changes do you notice when you're more or less impacted by your work? And we really encourage people to actually develop self-care plans. As health practitioners, we're very good at telling other people how to look after their self-care, but we're not so good at doing it ourselves. So just making sure you've thought about it and have a plan. If you start to notice some of these themes, this is probably a time when it's important to ask for help. So the things around avoidance. So if you're not looking after yourself, if you're not catching up with your friends, if you're not finding time to socialise and do things that you normally do, whether it be sport or whatever, that's a concerning sign. There might be elements of the work itself that you're avoiding doing. If you're feeling wound up, having difficulty relaxing, if you feel as though you're vigilant, you're anxious, you're not sleeping so well, don't just ignore those signs. Do actually think about seeking help. And if you start to notice some of these change in the way you're thinking yourself, sometimes, you know, you can, if you're working with clients who see the world in a certain way, you can start to see the world in that way yourself. That's a bit of a sign that you're being impacted by that and need to think about it. Just aware of the time, so I'm going to fly through. So just to say, I guess, that the commitment to trauma-informed care is a shared responsibility between the organisation and the individual. For organisations, it's important that they provide training and support for staff and encourage self-care, but also for individuals, it's important that we take responsibility for our own self-care as well and do that proactively rather than wait until we feel as though we're really starting to struggle. And burnout is avoidable, it's not inevitable, and in most cases people will be fine, but don't take it for granted. Do look after yourselves. That's it. Thank you.